Hello and welcome to Engage, the program that highlights community-engaged learning, service, and research here at Mississippi State University. I'm Michelle Garraway from the Center for Community-Engaged Learning, and today I'm joined by two 2020 Community-Engaged Research Project winners here at Mississippi State, Dr. David Buys and Miss Masey Smith. They're both from MSU Extension and the Department of Food Science, Nutrition, and Health Promotion. Welcome to you both.
Thank you.
Before we get into your project that won an award this past year and talking more about that, I'd like to hear more about you and how you've come here to Mississippi State. Dr. Buys, if you'd like to start.
Yeah, well, so I'd say first, my roots in Mississippi run deep. I'm seventh generation Mississippian, so just proud to be working back in my home state. I came to Mississippi State in 2014 as the state health specialist for Extension. And I'm a faculty member in the Department of Food Science, Nutrition, and Health Promotion. I love my work across the state with extension agents and community partners of all sorts. So thanks for having us today.
Great, great. And you, Ms. Smith?
Yes, I'm Masey Smith, and I came here a little over 2 years ago to work on Dr. Buys' team in the Health Sciences Initiative, and have been excited to work with Aim for Change in our multi-sectoral coalitions and especially the Delta region.
Awesome. Well, I do want to ask you more about Aim for Change, which is why we're really gathered here to talk today. So what is Aim for Change? What is its mission? How is it involved with the community and the partnership here with MSU?
Yeah, so it is a CDC-funded project. To Extension, we work with partners all across counties that have obesity rates at 40% or higher. We have several institutional partners as well. We work with the University of Mississippi Medical Center, the Mississippi Public Health Institute, and others. Our mission is to really address obesity in somewhat unconventional ways in those communities. So there's been a long history of doing, particularly in cooperative extension, an extension of doing direct education, bringing folks into a sort of, kind of informal class-like setting and teaching them about cooking or nutrition. And we're recognizing that just with the changes in the way that we do life, that is not as effective. And so we're really going upstream of the problem and upstream of that as a solution, working on what we call policy, systems, and environmental approaches to address obesity. We like to say we're trying to make the healthy choice the easy choice.
Okay, great. So how long has Aim for Change been going on? Is this a fairly recent project, multi-year, or?
Yeah. We were funded in 2018.
Okay.
And began work then. Of course, Extension, I got to plug my home organization. Extension's been around for more than a century. 1914 is when we were officially sort of institutionalized with with legislation out of DC. But Extension's been around at least that long, if not longer. Aim for Change, of course, is working in the context of Extension since 2018.
Okay. And so the partnerships that occur through Aim for Change, I'm particularly curious about that because many of the projects that are recognized through the awards program that I mentioned, we do like to highlight great partnerships and how that works within the community. So I'm interested to hear about your partnerships, how those have formed, how they've evolved, what kinds of impacts you've seen in communities, and how those have really reciprocated here at Mississippi State University.
Masey, why don't you take that? You work a lot with our folks on the ground.
Sure. A lot of our partnerships really showcase sustainability through community action. So there's a lot of active representation within what we do. We don't go into communities and tell them, this is what you need to do. We go to communities and ask them, how can we help you improve your quality of life and improve community health? And so a lot of those solutions come from the communities. They may be working on a community garden and need technical assistance, resources, or funding, like we have in Belzona, Mississippi with Keep Belzona Beautiful. And so with that, we've been able to leverage their ongoing work with what we can provide in the Delta and also in our office, and partnered with the CDC and in our other institutional partnerships, and help them grow and develop. And so it's very community centric. In other projects, so like with our food pantries, which has been a huge drive for our program, we've seen that sometimes food pantries just need some insight onto best practices and how to develop those policy, system, and environment changes and make those sustainable in their community. So finding outlets for food and developing policies that enable them to build, not just the capacity for food, but maybe volunteers and leveraging resources. And so it's not really our team, it's our team and the communities, and letting them or working with the communities that lead that change.
Sure, okay. And you talked, thank you very much, Masey, you talked about like the partnerships, how that's really impacted the community, how you've been able to operate within the community. Have you had, let me ask more about your team, I guess I should say. I know obviously it encompasses the two of you. Do you have other staff here that go out with you working in these communities? Do you have students that come along? And if they do, what impacts are you seeing in those relationships?
Yeah, so we do have other staff on board. Another staff member here on campus, we have extension agents that we have hired specifically for work with Aim for Change out in the communities. Our traditional agents do some of this work inherently in their jobs day to day. We needed folks that could be specifically focused on this, and they are a key part of those extension agents, and their connection to the communities are a key part of our success. We have a grad assistant. We bring undergraduate student workers on, and that's one of the things that excites me most. As someone who loves public health, I trained to do public health. To be able to be at a university and do public health practice essentially, and engage students. I don't just study public health, I get to do it and bring students into the process. So that's one of my favorite aspects of this position that I have, and particularly Aim for Change. I wish I had more time to spend with the students day to day, but props to Masey and our other staff that mentor them day in and day out. They spend a lot of time helping them understand why we do what we do, not just giving them an assignment, hey, go make these copies, hey, go do run this errand for us, but really getting them engaged. And since this is we're being on the show to talk about the research-based community engagement award, we got to mention we've had some scholarly products, quite a number of scholarly products that have come out of this. We submit and present our work at scholarly academic conferences. We have published, I think, 4 peer-reviewed papers and journal articles to date. Good. And some of that's because of folks in our immediate team, but we've got colleagues all around campus. We've got Dr. Elizabeth Canales in Ag Econ, got Peter Summerlin in Landscape Architecture, Megan Holmes in Kinesiology. We work with Corey Gallo in Landscape Architecture. And I hate to start naming names because as sure as I do, I'm going to leave somebody out. But those are just some of the ones that bubble up. And the reason I mention them is they're ones that we're working on scholarly products with. We work with SSRC. They're the external evaluators on our project. Right. And again, the scholarly piece of this is important. Agreed.
Especially since as you mentioned, the partnerships and the work that this project is doing is very important, but also was recognized because of its scholarship piece and its research piece. Something that both of you have already mentioned that I wanted to drill down just for a minute on, we don't have too much more time, but in terms of working out in the communities, something that I think may not be talked about as much is about how those relationships are formed. If you had any advice for other faculty or staff or student members here at Mississippi State that are embarking on partnerships or wanting to work within research with communities, what is your advice about how to do that well?
I think with any kind of community-based participatory research project and really just community engagement, it all starts with local leaders. So getting engaged with someone from the community and letting them kind of echo that out and make waves in the community, so them connecting you, because especially through extension work, having a gatekeeper and building trust in the community, it can take years. Even as, land grant universities starting in the 1860s and then revamped in the 1890s and then in 1914 with MSU's establishment, we see that, this is something that takes time, and these are relationships that need to be cultivated, and people need to feel valued. And so going to community members and starting with a local champion and using that relationship to build outward is a more sustainable way to build community trust and ultimately to reach the success of any project.
Great, thank you very much. And just with the very short amount of time we have left, if someone is interested, so I know it's a funded project, it's funded for probably a certain number of years. You're hoping to have plans for the future and things that you want to do in the next few years, I'm sure. If someone seeing this that is within the state of Mississippi wants to get involved with what Aim for Change is doing, what are the best ways for them to go about doing that?
So in the counties that we're in the Delta, and then most of our counties are in the Delta, our coalitions are open, and we encourage and really want to increase partnership and continue to network across Mississippi. And so if they want to get involved, they can contact me or Dr. Buys, they can contact our extension agents, and really anyone in our office. We do have a website for Aim for Change on the extension website, and so you can go there and contact us or just reach out individually, and we'll get you involved in a coalition or a project or even some of the research that Dr. Buys mentioned.
Right. Well, there is never enough time to really get into all of what I want to talk about these projects. I encourage anyone seeing this to really look at ccel.msstate.edu. You can follow those links to look at more information about Aim for Change and our other award-winning projects. And I encourage you to reach out and learn more information and get involved if you would like to. Thank you for joining us today, and we'll see you again next time.